all your favorite products under one roof in Bahrain from our 14 branches at 27-year-old Megamart and Macromart. Bakery, fresh meat and fish, fruits and vegetables, sweets and snacks, ready-to-eat foods, dairy products, grocery or consumer goods. To have a wonderful shopping experience, please visit your nearest Megamart Macromart branch. Megamart and Macromart, full of goodness.
Hello dear friends, Ramadan Kareem to everyone. As we have entered the holy month of Ramadan, we wish you all a happy and blessed Ramadan. Today the topic of discussion is a healthy Ramadan. We have with us Dr. Rabia Muhammad Nazir. She is a general practitioner from Al Hilal Hospital, Hamad Town. So let's welcome Doctor to the show. So Doctor, welcome to the show and thank you for being here in this holy month of Ramadan.
Thank
and
you
Ramadan
for
Mubarak
having
to
me.
you.
Yeah, thank you so much. Ramadan Kareem to you and everyone as well.
Thank you, Doctor.
Yeah.
So, Doctor, we know now we are fasting.
Yeah.
Some people are, in some countries, it's almost 12 hours, in some countries more than 12 hours.
Yes, that's
so,
correct.
how does fasting affect our body?
So when you're fasting, generally your body needs two things. One is water, another is energy source. So water comes from water in general. So first of all, if you're not drinking water, your body will try to reserve the sources of water which it already has. That is water in the blood. So how it does it is that it keeps the water inside the body by reducing urine output. Secondly, the resources for energy, which is during fasting, main source of energy is fat stored in our body. So when you're fasting, the fat which is stored in the body, it breaks down and it acts as an energy source during the time that we are fasting.
So, Doctor, how can we hydrate well? What's your suggestion?
That's a really good question. During fasting, we're not able to drink water. And in Bahrain, it's mostly 12 plus hours of fast. So that means that we won't be able to drink for a long period of time. So what we can do is make sure that we are well hydrated otherwise after iftar and till suhoor we are trying to drink as much as water in any form as possible, which includes any form of liquid. So I would recommend you to take more water plain water is the best source. Apart from that, we can also take fruits which are rich in water. For example, watermelons, strawberries, grapes, etc. We can also opt for soups. Soups is a really good source of generally protein and water as well. So soups of any sort can be used after iftar, even during suhoor as well. Some people also tend to take leban and lassi. These are also really good sources of water, and I would recommend not to add sugar in those.
Okay. So people frequently complain about gastric problems during Ramadan.
Yes.
So what is your observation?
Most of the time we tend to eat food which is high in fat, oily content, fried food, especially after iftar. So what happens is that our body, which is fasting for 12 hours or so, it already has an empty stomach.
Yeah.
An empty stomach has a lot of acid in it. When we put a lot of fatty things or oily things in an empty stomach, it will cause a reaction to the body, which will in turn depict as gastritis. So most of the times what happens is that during iftar time, we tend to eat food which is mostly high in fatty content or is fried. So what happens during fasting, our stomach is empty for practically 12 hours. An empty stomach is full of acid. When you put fatty things in it, it will cause a feeling of gastritis, which is gastric reflux, which will show as heartburn in some patients. Sometimes it will show as nausea, sometimes bloating, sometimes it will show as feeling of fullness and uncomfortable feeling. So this is basically gastritis. In order to prevent it, try not to eat a lot of food which is high in fat, high in oily content, fried foods, a lot of meat, a lot of spices, and people also tend to drink a lot of caffeine or coffee after iftar because they're practically dying for caffeine after iftar. Of course, everyone is. So that also tends to affect a lot of acid production in the stomach, and it in turn presents as gastritis. So there would be a recommendation of reducing fatty food, oily food, caffeine, and increase water intake, increase whole grain foods, increase water content foods, which are soups, fruits, and dates are also a very good source as well.
Okay, doctor, that is very interesting. Now, can you explain about some of the medical conditions in which we should refrain from fasting?
There are multiple conditions or situations where a person can be exempted from fasting, which could be very young children which have not hit puberty yet, or very old people who are the elderly people. And then there are certain conditions like acute conditions, for example, acute as in which happen right now. For example, flu, if you're sick with flu, if you have gastritis, if you have gastroenteritis, which is nausea, vomiting, loose stool, these conditions. Apart from them, chronic conditions like high blood pressure patients who have hypertension or cholesterol issues or diabetes issues, or some people who also have heart conditions, for example. And then there are people who are pregnant, breastfeeding mothers, women who are menstruating. These are all exempted from fasting.
Okay, now you mentioned about diabetes and fasting.
Yeah.
Can you make it a little more clear for us?
Absolutely. So there are certain conditions, chronic conditions, not only diabetes, there is hypertension and high cholesterol as well, which is hyperlipidemia. These are the most common chronic conditions which are found in Bahrain, for example, and general population around the world as well. So we can talk about one by one. We can talk about hypertension first. Hypertension during fasting is rather controlled well if you tend to make good choices. If you reduce salt intake, increase water intake, try to go out for a walk after iftar, preferably for at least 30 to 45 minutes. These practices and habits can help you control your blood pressure or high blood pressure during Ramadan. Secondly, high cholesterol. According to researches and studies, it has been proven that since our body breaks down fat to use it as a resource during our fasting period, so our body tries to use the fat and in turn reduces the fat in the body. So that also is lipid. which is stored in our body. Eventually, if we make good choices, try not to eat a lot of fried food, oily food, fatty food, meat. Try not to lie down after eating food after iftar and go for a walk for 30 to 45 minutes. These all habits can also help us reduce our cholesterols in our body during Ramadan. Thirdly is diabetes, which is most important out of all the chronic conditions, because diabetes is of various types, and it depends upon the type of diabetes how it can be managed well during fasting or during Ramadan time. First and foremost, if you have any kind of chronic conditions, firstly you should go to your doctor who's treating you to discuss with them if you are well controlled, if your condition is well controlled, if your medication is enough for you, if your blood values or the blood test ranges are within good range. That means it's well controlled. So you need to discuss first and foremost with your doctor if your body is good enough to be managed, or your conditions to be managed during fasting. Secondly, diabetes. It depends upon the type of diabetes. First of all, if you're having type 1 diabetes or suffering from type 2 diabetes, you'll be treated differently. For type 1 diabetes, it's treated by insulin. For type 2 diabetes, it's treated by oral anti-diabetics, or it can also be treated by use of insulin, both. So you need to talk to your doctor about how well your general blood sugar is maintained in normal days. Only then you will be able to figure out a plan how you can manage your diabetes during fasting. Most importantly is to consider the fact that when you have diabetes, your blood sugar will be very fluctuant if not well controlled or managed well. In fasting state, your blood sugar will be fluctuant. Sometimes it would be very low, sometimes it would be very high. For example, when you're fasting, the blood sugar tends to go down. If you're taking iftar and if it's certainly high in sugary contents or fried foods or other things, your blood sugar will spike suddenly if you're taking a lot of juices, for example.
All your favorite products under one roof in Bahrain from our 14 branches at 27-year-old Megamart and Macromart. Bakery, fresh meat and fish, fruits and vegetables, sweets and snacks, ready-to-eat foods, dairy products, grocery or consumer goods. To have a wonderful shopping experience, please visit your nearest Megamart Macromart branch. Megamart and Macromart, full of goodness.
Doctor, when should we seek medical help during fasting?
Okay, so that's a very good question. Most likely complaints during fasting are of dehydration and hyper or hypoglycemia. So what are the signs of dehydration? Let's discuss that first. Most of the times when you have dehydration, you'll feel tired, you'll feel thirsty, you'll feel like you have a dry mouth. Sometimes patients feel lack of energy, tachycardia, which is faster heart rate or palpitations. Sometimes if a person is severely dehydrated, they may feel dizzy and faint as well. So these are the signs and symptoms which one should look out for during fasting. If at all, if you feel that you have these symptoms or complaints, you can seek for help from a doctor, or you can break your fast and take water with electrolytes as soon as possible and then seek medical care as well for dehydration. Secondly is hyper or hypoglycemia. Hyperglycemia is high blood sugar levels in your blood. Hypoglycemia is low blood sugar. High blood sugar can cause you to have confusion if not treated at the right time, or if it's severely high as well, if your blood sugar is severely high. So what you need to look out for is if you have diabetes and you feel that you have dry mouth, you're going to the bathroom a lot, or if you're feeling a faster heart rate, or if you're feeling confusion, or your level of attention is not as it's compared to as it's normally is without fasting, or if you feel that you're about to faint. These are also signs of hyperglycemia. So you need to break your fast as soon as possible and check your sugar as soon as possible, and depending upon the sugar level, seek medical care as soon as possible as well. For hypoglycemia, if you feel that you're about to faint, or if you feel your heart is racing fast, or if you feel like your attention level is not as much, you're feeling lack of energy, you need to break your fast as soon as possible. Check your blood sugar level. If it's below 4 or 72 milligrams per deciliter, you need to break your fast immediately, eat something sweet, and seek for medical care.
Okay, doctor. Another common query is, can pregnant women fast during Ramadan?
So pregnancy is a very challenging time in general. When you're pregnant, it's not recommended to fast because your body is already using its resources to take care of yourself, and also development of the baby requires a lot of nutritional things. So when you're fasting, it's generally not recommended to fast. First of all, you should talk to your gynecologist about your general health condition. If it's well controlled, if you don't have any complications, if your baby is growing well, if you don't have any side effects or complications during the pregnancy, and if your nutritional needs are met or not. So during the pregnancy, sometimes it is, according to studies, it's been shown that a few pregnant patients, they do develop complications if they're fasting for a longer period of time. Their baby might have lower birth weight, their placenta may be smaller, the blood flow or the nutrition to the baby would be less, so in turn the baby would be of a smaller size. But there are also other studies which show that fasting does not affect the baby or the pregnancy in general. So these are something affected by general health condition of the mother in general. So if a person is of good weight, is eating well, there are no complications during the pregnancy, and the baby's development is good so far, they don't have any nausea, vomiting during the pregnancy so far before the fasting period, they could have a good Ramadan with fasting as well. If at all, if you feel that you want to fast, so what you can do is you can opt for fasting on alternate days. So you can take care of yourself and the baby as well and fast as well. Apart from that, you can keep yourself hydrated, drink a lot of water during suhoor, iftar, and in between as well when you're not fasting. And try to take a lot of food, just like we discussed, food which is high in water content, soups, fruits, vegetables. This will not only help you with controlling your water or keeping yourself hydrated, it will also help in keeping your body nourished. Along with that, it will help with constipation in general, or prevention of constipation during Ramadan, which is also another common complication during Ramadan or fasting. Thirdly, what you can do is recommended nutrition or multivitamins, let's say, during pregnancy. Make sure that you're taking your multivitamins or supplements during fasting as well, during suhoor or iftar, whenever you feel comfortable, but make sure to take them to take care of yourself and your baby as well.
Okay, so it depends on each woman.
Yes.
Each woman, I mean.
Yes.
Okay.
It's very personalized and individual based.
Now coming to the most important part of our discussion.
Sure.
Can you suggest a healthy diet for us during Ramadan?
Of course. So most important during the whole of Ramadan is to take care of what you're putting in your body. Most important is to keep yourself hydrated. Most important source is water, which is plain water. I would recommend taking at least 5 portions of fruits and vegetable when you're fasting. This will not only help with the water intake, better antioxidants, vitamins, nutrition, which is a very good, fruits are a really good source of all of this. Along with that, help with a lot of fiber for the gut, which will help in prevention of constipation. Secondly, in suhoor and iftar, try to take more protein. Protein not only tends to help your body with nutritional values, but it also helps you keep full during the day and make you less hungry during the day when you're fasting. So thirdly, try to opt for things which are whole grain, like whole grain cereal, high fiber cereal, oats, brown rice. These are buckwheat. These are all good sources of fiber and would make you feel fuller for a long period of time. And since these are complex carbohydrates, they will not shoot up your blood sugar levels as well, especially in diabetic patients. So it will help in regulating blood sugar as well. Fourthly, try to take smaller meals. Don't eat too much too quickly, especially at iftar time. When you're breaking your fast at iftar, first and foremost, try to drink a glass of water, plain water, with a date or two. Then take some time, pray, and try to eat something which is high in complex carbohydrates and protein. You can opt for soup. You can also take something like chicken, grilled chicken, salads. These are really good sources to be used, especially at iftar time, so that your stomach does not suffer later on. Try to avoid fatty foods, fried foods. We tend to eat a lot of samosas and rolls and everything which is fried. So if we do want to eat them, we do have another option that instead of frying them in oil, there is another option of air frying. So if we use that, that would be less in oil, and you can enjoy these things as well after iftar. And apart from that, try to don't tend to drink a lot of caffeine after iftar. If you drink a lot of caffeine at iftar, you will have a lot of headache in the morning. Why is that? Because these are withdrawal symptoms of caffeine. What happens that your body tends to be dependent upon caffeine for functioning. Once your body is deprived of caffeine, it will start feeling lack of energy, tiredness. Headaches are the most common complaints during Ramadan. A lot of patients come during the morning time that we have a lot of headache and we are not able to focus on our work. So these are signs of withdrawal of caffeine in general. Apart from that, don't smoke a lot try to reduce smoking during Ramadan, especially after iftar. People tend to smoke a lot of shisha as a way of gathering or having a good session of meetup after iftar. So I would recommend refraining from that as well, and trying to go out for a walk for at least 30 to 45 minutes. For example, if you're going for Tarawih, take a walk to the masjid, or if you have stairs at home, try to take the stairs when you're going to the masjid as well. These all help during Ramadan to help manage our health or our general well-being as well.
Thank you, Doctor, for giving a lot of valuable tips for us. Now, what's your advice for our viewers?
So general advice would be to be aware of what you're putting in your body, being more aware of the main purpose of Ramadan, which is ibadah, and taking our time to pray and be well for that prayer as well. If you're not putting good things in our body, we won't be able to feel that energy to do these ibadah as well. So try to eat better so that you have a good energy level during the day, so you can pray, you can read, you can do your general activities in general as well. And apart from that, refrain from eating a lot or eating a lot of fatty foods. Try to talk to your doctor before starting your fast, especially if you have a chronic condition, so that you can have a plan during the Ramadan time, so you can manage your conditions in the best way possible. And these will also affect your condition or your health in the long run as well. So try to talk to your doctor and visit them as soon as possible before Ramadan.
Thank you, Doctor. Thank you for joining us and giving us a lot of valuable information.
You're welcome.
Thank you once again.
You're welcome. Thank you for having me.
So viewers, have a healthy and happy Ramadan. I hope you got a lot of valuable information about a healthy diet and also how to hydrate yourself. So be happy, stay healthy. Till we meet again next time, this is Jasila Mujib signing off. Good night.
All your favorite products under one roof in Bahrain from our 14 branches at 27-year-old Megamart and Macromart. Bakery, fresh meat and fish, fruits and vegetables, sweets and snacks, ready-to-eat foods, dairy products, grocery or consumer goods. To have a wonderful shopping experience, please visit your nearest Megamart Macromart branch. Megamart and Macromart, full of goodness.